Learning Plan 11, your second last learning plan for this course. So, this learning plan is about managing nursing care for the health needs for the community, including vulnerable populations such as disabled, homeless, mentally ill, elderly, teens, chronically ill, and culturally diverse. So, yes, it's really a big learning plan. I tried to pare it down as best I could, but it really does cover an awful lot of content. Now, this is also an awful lot of reading. As I go through, I will kind of give you hints. You really don't have to read every single word in all of these chapters because literally some of the information really is just very brief, very basic, just to get an idea of what types of health needs that we're looking for in these different populations, what we're kind of focusing on in Healthy People 2020 or just in from taking a community or public health perspective. So don't look at this and completely get upset because it is an awful lot of content that's covered in this learning plan. So we're going to get through this and do the best we can. So, Chapter 21, Populations Affected by Disabilities. So, as nurses, obviously, we are going to be working with people that have disabilities. We might even have some coworkers that have disabilities. So, disability is really kind of a broad term and it can encompass so many different things. So, just to start out with, though, something to think about. Most people whose lives do not end abruptly will experience disability. Most people. Oh my goodness, that's kind of a sobering thought, isn't it? Most people whose lives don't end abruptly. So in other words, you don't die of instantly in a car accident or, die instantly of a heart attack will experience disability. So that really does mean most of us. I actually went to a nursing conference some years ago where a man who had become disabled was in a wheelchair and he looked at all of us in the audience, most of us being nurses, and he said, "You are all temporarily abled. I am disabled. You are all temporarily abled." Again, kind of a sobering thought, makes you think a little bit that right now perhaps you don't have any disabilities, but it's possible that, or even if you live a long life, it's even likely that this will be something that you will go through personally in the future. And again, as nurses, we certainly are working with people with disabilities all the time. So again, as I talked about a lot in the mental health learning plans, always have to do that self-assessment. So what is my perception of disability? So picture what it's like to be, if you were born with a disability. Envision yourself unable to use your arms or legs or being confined to a wheelchair and dependent on the assistance of others. So even if you've had opportunities in your life where you've been in a wheelchair or been on crutches because you had some surgery or broke your leg or something, at least it does give you a little bit of a taste of what that person who is disabled is going through, but truly think about it. It's, in your mind that your leg is going to heal and this is only temporary. So maybe it gives you a little bit of empathy, but still quite a bit of difference in terms of somebody who truly is confined to a wheelchair and is dependent. Consider preparing yourself for the day with the use of only one arm from a wheelchair. Yikes. Oh my goodness, I'm thinking, how am I going to do my hair, my makeup, get dressed in clothes that match, put some jewelry on maybe. So can really make your life very difficult. So, and it further complicates the situation with a significant health concern, such as if you have diabetes on top of the disability that requires close monitoring or medication. So again, part of that self-assessment, consider individuals who are healthy since birth and just now became disabled by a disease or accident. How are they going to adapt? How would their employment be affected if they have financial resources in personal and emotional support? So just again, trying to put ourselves in the shoes of somebody that this might happen to suddenly. So some of you may know people in your own life that were healthy, but all of a sudden became disabled. So we have a friend who developed multiple sclerosis and basically is in a wheelchair at this point in his life, and really has had a great deal of difficulty adapting to that. He was an electrician, so he was very active and very busy, used to climbing up on ladders, and really took pride in his work. Unfortunately, was unable to continue in his line of work because of his declining physical health. So just think about all the things that people go through when they suddenly become disabled. And then think about living in a family affected by disability. And maybe some of you have family members that have disabilities. Consider the impact of a child with a disability on parental activities and family roles. So how sometimes the whole world gets turned around and everything is perhaps focused on that child. Maybe some of the other kids kind of feel left out, have a difficult time feeling like they're getting their needs met. So they may start to act out in different ways. So a disability doesn't just affect the person, it affects the whole family, especially if it's a child. And again, just to think, what is the experience of living with a disability within your community? So wherever you live, do you feel that that's a place that is friendly to people with disabilities? Are there a lot of places that are handicapped accessible, or are there many that aren't? So really, what is that like? How are people in general terms, how are people accepting of people with disabilities? So definitions and models for disability: the Americans with Disabilities Act of 1990 and the Rehabilitation Act of 73 define having a disability by how it limits carrying out a major life activity, such as the ability to breathe, walk, see, hear, speak, work, care for yourself, perform tasks, or learn. So again, you can see that this really is encompassing. Disability really encompasses so many different things. We might think very narrowly that it's just somebody that's wheelchair bound and they can't get around by themselves, but some people have really severe breathing issues, even allergy issues. I have a neighbor who I actually have never, ever seen. She comes out of her house, but she gets into her car with the garage door still closed, and then she opens up the garage door only when she's in her car, and then drives herself to work. Not sure where she works, but or if she's exposed to. Apparently, she has a very serious allergy to grass, and so that's why I never see her outside, and you don't even see her getting out of the car in the driveway because she waits till she's fully, the car is in the garage, she puts the garage door down, and then she gets out of her car. So just think about what that must be like to how that would really curtail your life. Well, first of all, she doesn't know any of her neighbors. None of us know her. I couldn't even identify her if I ran into her in the grocery store. So there are lots of different types of issues that people can consider disabilities. I actually know another person who is very, very severe reactions, again, kind of breathing reactions. I don't think it's migraine, but to very strong smells. So this person can't touch anyone. She has a very hard time in work environments because people wear lotions, perfumes, scented anything really just drives her wild. And it's not just that she doesn't enjoy it, it's that she truly has difficulties with her breathing. And I'm not sure, but I think she may also get headaches related to strong smells. So some of those things really can put a big impact in your life. So disability, just get our definitions out of the way. Disability is kind of an umbrella term covering impairments, activity limitations, and participation restrictions. And then developmental disabilities are manifested by limitation before the legal age of adulthood, which is 18. Impairment is a problem in body function or structure. So that limits activity, or again, limits somebody's ability to participate in different activities. And activity limitation is difficulty encountered by an individual executing a particular task or action. A handicap is a disadvantage resulting from an impairment or disability that prevents fulfillment of an expected role. So sometimes I think we use those terms kind of interchangeably. Impairment, disability, handicap. I think people tend to think they're all the same thing, but they truly are a little bit different. So the National Agenda for Disability model any condition of the body or mind that makes it more difficult for the individual to do certain activities and interact with the world around them, which influences their quality of life. So that is a quote from the CDC, Centers for Disease Control, in 2015. So that just really kind of sums it all up very nicely. So it could be, again, any number of different types of conditions. The social meaning of disability, kind of interesting because, again, I put in red, disability can be kind of a label and it does signify social marginalization. So people with disabilities sometimes are put on the outskirts of society. They're marginalized. They're not given full recognition or full treatment and allowed to do certain things that other people are allowed to do. So two really interesting points. It is possible for a person to be disabled without recognizing him or herself as such. I think that's really an interesting one. So I guess as an example, I could think about somebody who goes to the gym where I exercise and basically wheels himself in on a wheelchair, truly has no use of his lower extremities at all, but has very, very strong upper extremities, gets himself in and out of the wheelchair, into his car, out of the car, onto the different machines, transfers himself beautifully, exercises his upper body as much as he can, works a very high functioning type of job, which is more of an intellectual type of a job, and is certainly involved in the community, does volunteer work. I don't know that I'd really consider that person disabled. So I would guess that he wouldn't think of himself as being disabled, lives a very, very full life. The other aspect is that it's possible for one to be disabled without being recognized as such by others. So think about, again, the person in my neighborhood who I've never seen, who has this terrible grass allergy. I'm assuming she looks healthy, and you wouldn't, by looking at her, know that she had this disability. My friend with severe environmental sensitivities to perfume, soaps, things like that, she literally can't even touch people. She doesn't even want to ever get a hug from anybody because she's worried about people having scented lotions and perfumes on. So I would say that she has a disability, but nobody would really recognize that unless she is open and verbal about it. So culture, education, and the social organization can shape how all individuals perceive disability. So a little bit of a historical context. People with disabilities have sometimes been viewed as mascots, and this is the quote. This slide came from the textbook. So fascinating freaks, that is not necessarily a phrase that I guess I would pick, but I think that perhaps that was a terminology used years ago. There are a lot of different terms that were used years ago, like even being insane and things like that, insane asylums, and there's all kinds of words that kind of are in our past, and that probably is one of those. But I think the real meaning behind that is that people are just fascinated because they are so different from other people. So maybe think about conjoined twins that are not able to be separated. So a person like that could possibly be considered in that category. In other cases, they've been isolated, ridiculed, discriminated against, or worse, marked for extermination. So, and I think the example that they give in the book is basically Hitler and what he put people through, marking people for extermination that he felt were less than human. So a little bit of history. So again, early attitudes, they were set apart from others. They were viewed as different or unusual. Think about leper colonies even. People had a terrible disease, and of course it is a contaminant, about that. Contagious disease. That's what I was trying to say. So, of course, it was contagious and people were worried about getting it, and there was no treatment way back in the day. But still, that aspect of being set apart from others and, being just really viewed as unclean. And I believe they even had to, whenever they tried to venture into the community at all, had to shout unclean so that other people around them knew that they had this disease and could stay away from them. And certainly way back in biblical times, many times when people had different types of abnormalities, that they would be viewed also not only as unclean but also sinful. And again, some people have served as entertainers, circus performers, sideshow exhibitions. Oh my goodness, what is wrong with me? I can't talk tonight. Okay, so contemporary conceptualization of people with disabilities. In the 50s, the Association for Retarded Children, and again, that's another term that we don't necessarily use these days, but they began to at least advocate for children with those intellectual disabilities. So the world's largest community-based organization of and for people with intellectual and developmental disabilities. So that is what their purpose is. And the concept of independent living began with the deinstitutionalization movement in the 60s to the 1970s. So at least that was a good concept, that people don't need to live in institutions, that they can live independently. But I think I mentioned this probably way back in Learning Plan 1, perhaps, that when deinstitutionalization took place and people with chronic mental illnesses were let back out into the community, then there were no services, or not very many services, to help them to integrate, and many of them just ended up being rehospitalized again. So global perspective on culture and disability. So individuals in other parts of the globe have varying perspectives, in different parts of the world. Some cultures actually believe a child born with a disability is a result of some past wrongdoing. Researchers believe education on preventative measures will decrease prevalence of disabilities. And rural, undereducated, poor may not be getting suitable treatment for their disabilities. So just some things to think of from a little bit of a global perspective. So the prevalence, 15% about worldwide, over 1 billion people have some form of a disability. In the United States, 12 to 20% are disabled. 6.3%, more than 15 million people have a mental disability. So more than 15 million people have a mental disability. I think I said that too fast. 3.6 million people use wheelchairs, and 8.4 million people have emotional disorders. So again, just a little bit of a look at the scope. So we need to differentiate illness from disability. So the nurse should not assume a need for an intervention. Ask the client if they want assistance. So I know that it's really tempting sometimes. We see somebody in a wheelchair and right away we want to run up and help them, hold the door or do something for them to help them. But many times people really like to be independent and perhaps don't need or don't want that extra help that you might be wanting to give them. So it's always a good idea to ask somebody if they want help. Try to listen to understand their perspective, collaborate with them to make plans and goals, and collaboration promotes self-determination and allows choices that foster their own values and preferences. So CUSIN, think about CUSIN, patient-centered care. We really should be trying to help the patient to meet their own individual needs and goals. So the Americans with Disabilities Act of 1990 and the ADA amendments of 2008. So the ADA, Americans with Disabilities Act, was a landmark civil rights legislation that prohibits discrimination towards people with disabilities in everyday activities, guarantees equal opportunities for people with disabilities related to employment, transportation, public accommodations, public services, and telecommunications, and it provides protection to people with disabilities in the same way as those are provided to any person on the basis of race, color, sex, national origin, age, and religion. So that was really huge to have those rights really honored and respected. And the Americans with Disabilities Act refers to a qualified individual with a disability as a person with a physical or mental impairment that substantially, again, limits one or more major life activities or bodily functions. A person who with a record of having such an impairment, or a person who is regarded as having such an impairment. I know some of these definitions are a little bit wordy, but I guess from a legal standpoint, they kind of have to be that way. Qualifying organizations must provide reasonable accommodations unless they can demonstrate that the accommodation will cause significant difficulty or expense, producing an undue hardship. So that issue becomes difficult when somebody is looking for a job. So I think probably by this point, most places of employment, most places of business have doorways that are wide enough, handicap accessible entrances, things like that. But it could be a whole different issue depending on the person's disability and the job that they would like to do. So maybe somebody is completely, fully qualified for a job, and the employer feels that they can't accommodate them because of the having to maybe they have to do $20,000 worth of construction and repairs in order to make their place of employment handicap accessible. So they could say, based on that would be undue hardship, because that would be a significant expense. So that is a way that where people don't always get the accommodations that they need if it causes that undue expense or difficulty. Other than that, if it's a matter of just rearranging a workplace or something like that, then that person should be hired based on their ability to perform the job, and certainly should not be discriminated against because of perhaps being in a wheelchair, for example. Prevalence of disability in children. More than 8% of kids under 15 years of age have some kind of disability, and about half were classified as severe disabilities. So among children with special needs, almost 32% had ongoing emotional, behavioral, or developmental conditions requiring treatment, and almost 60% reported difficulty with one or more emotional or behavioral factors. So disabilities in children certainly is another whole topic we could spend hours on, and certainly if children get the care and the help that they need, that would enable them to become more independent and productive adults. So we really do have to think about children. So the family and caregiver response sometimes when you have a child with a disability, it really makes the whole family kind of redefine their own image and their expectations for their child. Everything is just completely turned upside down and inside out. The sibling response could be influenced by age, coping, peer relationships, parents, the impact on the family. So sometimes we really do have to watch the siblings also very carefully. I have an example of a family where one of the siblings developed a very serious issue with chronic seizures, and the other child began to act out because the child with the seizures was getting an awful lot of attention and appointments, doctor's appointments, surgery, different things. So the whole focus of the family seemed to be on that one child that was having difficulties, and the sibling ended up really acting out behaviorally in some very serious ways. So really do have to watch those siblings also. But again, it really turns, having a child with a disability turns the whole family upside down, and you really do have to rearrange and rethink perhaps your expectations for your future and also their future. So recommendations for the nurse would be to listen to parental concerns, especially if they really say, something is not right with my child. The parent truly is the expert on their own child, and We need to establish as a nurse an important bond with those parents, and the nurse can be an intermediary and maybe help advocate for that child to get their needs met or the family to get their needs met. So the nurse regularly assesses for key developmental milestones and works with a team of resource providers on that individualized education plan if they're school age. And we also have to just always be aware of disability within the context of culture, if there's any cultural aspects to that particular family child that we're assessing. Again, strategies for the public health nurse caring for people with disabilities, just to be familiar with strategies for communicating and caring for people with disabilities. Getting knowledge related to those health conditions if you're not familiar that may result from or lead to disability. Be aware of resources available and legal implications that affect that person with a disability. So again, going back to that example of the person with a disability applying for a job, perhaps that person doesn't know that there are laws that protect him or her. So if the nurse is aware of that, the nurse can give that person counsel, and if they have money issues, then there certainly are free legal aid clinics that can help people with disabilities. So again, just knowing the resources and knowing those legal implications that affect that person. We always want to be working with the interprofessional team to form alliances with the client and family, try to get rid of those barriers, incorporate true essence of advocacy again, and discerning the needs and resources of the client and family. Public assistance programs are out there to help people. So there's cash assistance, food stamps, public subsidized housing, costs associated with disability. They have gaps in employment, income, education, access to transportation, and attendance at religious services. So it is really a difficult thing to become disabled. I actually just thought about another example I have of a friend of mine who was in a terrible car accident in her 20s. And I believe she had already graduated from college and worked a couple of years, so she was in her mid to late 20s, but had such a terrible car accident that now she's in her, oh my goodness, she's 60, and she is still struggling with a lot of chronic health issues as a result of that terrible car accident. And she says that it's very difficult financially for her to make ends meet, that many times the money just, even with assistance programs, it's still very difficult to live the kind of life that she'd like to live. She definitely has had gaps in employment. I believe she also suffers from seizures, terrible headaches, things like that. Chronic pain, has had multiple surgeries over the years. So talk about gaps in employment. She is college educated and is certainly fully able to work, mentally, but it just really physically can't. So yeah, and her income just isn't what she would like it to be. At least she was able to get her education, but honestly, at this point in her life, not really able to use it for several years now. So health disparities, and that's another big issue with Healthy People 2020, is looking at those things that make people different and not let them get as high quality health care as they need. So we can think about disparities being caused by differences in access to care, provider biases, poor provider-patient communication, poor health literacy. And we've got another whole chapter on health education, and we'll talk about literacy later. So people with disabilities have higher rates of chronic illness, increased risks for medical, physical, social, emotional, and or spiritual secondary issues, and people with intellectual disabilities are undervalued and disadvantaged. Now, one thing I think is really interesting that I think is a very positive sign is that I've been seeing more and more videos out there in social media that are related to people with Down syndrome doing absolutely remarkable things. I unfortunately don't have one in the learning plan, but if I think about it, I will try to look for one. But people are doing modeling, acting, public speaking, all kinds of truly wonderful things with Down syndrome. And definitely historically, those people were very, very undervalued and disadvantaged because they're not, quote, functioning members of society. So very interesting. I really like that new trend. So some strategies for the community health nurse: don't assume anything, adapt the client's perspective, listen to and learn from the client, gather data from their perspective, care for the client and the family, not for the disability, be well informed about community resources, and become a powerful advocate. So that's kind of it in a nutshell, really. So we want to be, the client is knowledgeable and we want to be the knowledgeable nurse. So we have to look at the fact that the client has been living with this disability and they are sensitive to the needs of their body. They know what works for them. The nurse should ask the client what works best and what goals the client is pursuing. So what do they want out of their life? And the client needs the services of the knowledgeable nurse. So really both should be working together. A client newly diagnosed can benefit from the information about the disability and the available resources. So the nurse can be the knowledgeable one in that situation where the disability is new, and the nurse can provide lots of good information. So dealing with ethical issues, there are spiritual perspectives, quality of life and justice perspectives, proper use of scientific advances. So who gets the new scientific advances? How does that work out? Self-determination, deinstitutionalization, we kind of talked about already, and just basically the rights of people with disabilities. So this is a picture of a Wisconsin teen with disabilities, and just thinking about ethical issues, her situation created a lot of controversy. So I don't know if you recognize this picture, or if this was a couple of years ago, actually, about 3 years ago. In 2016, her name was Jerica Bolin, and she's from Appleton. And she apparently had a serious chronic debilitating disease that was not curable. And she was in tremendous amounts of pain. Nothing was really helping. And it was a disease that was chronic and basically was going to end her life at some point in time. She's from the Appleton area, and the picture that you're seeing is she threw a prom for her. I think her mom helped her. She had a prom for herself. She was 14 years old, so maybe wasn't even, I'm not sure if she was a freshman in high school or in 8th grade, but she kind of wanted one big last fling, and apparently hundreds and hundreds of people came to this event. And as you can see, she's got a sash on that says prom queen, and she has her hair dyed and makeup, and really received a lot of support from the community because she kind of wanted this one last fling before she decided to disconnect. I believe she was on a ventilator, and just decided that she really didn't want extraordinary measures anymore. And she actually died. She's from the Appleton area, but she died at Sharon Richardson Hospice in Sheboygan Falls, again, about 3 years ago. A lot of uproar in the community from the people that are advocates for people with disabilities, because they really felt like people around her were giving up, and like her mom gave up, she gave up. They thought maybe she was even suicidal. It was really a very, very difficult situation, but just something that kind of provokes thinking about the ethical dilemma side of when you have a disability, and should people have the right to say enough is enough? I'm not going to live like this anymore. Just really interesting. So if you haven't if you don't know anything about her, or you would like to do some extra reading, I can I could probably put a link out. I think there are some YouTube videos also about this, but I just remember it being a very difficult thing for advocates for people that are disabled. They really felt like this was saying like a disabled person's life wasn't worth anything, by her death. So just some heavy stuff to be thinking about here. And now we're going to be thinking about homeless populations. So Again, we've got all kinds of definitions, but please do not get hung up on all these definitions. We really don't need to be that worried, but I find it fascinating because before I started teaching this course, I guess I really didn't know that homelessness was so complicated. You just think, well, a homeless person is just somebody who's living out on the street. Well, it's a little more complicated than that, and so we have to think about some definitions. So there are some legal approaches also to defining homelessness, and all of these government agencies are federal homeless initiatives are assigned to 7 different departments within the branch of the federal government. Again, don't worry about like memorizing all these, but it is interesting to look at how complex this issue is and that there's so many different departments that are thinking about and working on homelessness. So the 4 categories, according to the HUD, Housing and Urban Development, Category 1 is literally homeless. Category 2, imminent risk of homeless. Category 3, homeless under other federal statutes, and which is kind of vague. Category 4, fleeing or attempting to flee domestic violence. So that person is almost kind of temporarily homeless. So anyways, just kind of interesting that there are so many different definitions. So literally homeless, boy, why can't I say that word correctly? Individuals and families who lack a fixed, regular, and adequate nighttime residence, and includes a subset for an individual who resides in an emergency shelter or a place not meant for human habitation. So people who are living in an abandoned building, or if people who are living at the Salvation Army or any other type of shelter, they still are considered homeless. So, all right, or if they're exiting an institution where they temporarily resided. So, the institution that first comes to my mind is jail. So somebody gets out of jail, so they're exiting that institution, and they were only there temporarily, of course. You don't live in jail, well, not usually. And so now where's that person going to go? They're kind of, unless they have a home or a family, they may actually be homeless. Category 2, imminent risk of homeless. So individuals and families who will imminently lose their primary nighttime residence. So basically, people that are losing their home for various reasons. Maybe their home is being foreclosed on, they can't make payments, they're being kicked out of their apartment, they can't pay their rent. And honestly, we have a lot of patients on 1K that are in that category. Unbelievable amount of people that are in this category. Some in the first category also, but many times that they're imminently at risk. Their family is kicking them out. Their mental health issues are so difficult and have caused issues that their family is saying, nope, you can't live here anymore, or they're being evicted from their apartment for various reasons, either not payment or perhaps some behavioral problems that they've had. Category 3 is homeless under other federal statutes, so unaccompanied youth and families with children and youth who are defined as homeless might qualify under that definition. And then again, that attempting to flee domestic violence, so they're trying to get away from domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions. So there's also a definition of a homeless student. So according to the McKinney-Vento Homeless Education Assistance Improvement Act of 2001, why do all these acts have titles that are just a mouthful? But anyways, that ensures that each child and each homeless youth has equal access to the same free, appropriate public education, including a public preschool education as provided to other children and youths. So definitely a very helpful act. And that includes children and youth who are sharing the housing of other people, frequently referred to as doubling up, abandoned in hospitals, or awaiting foster care placement. So Education Department 2016 estimates, 1,263,000 1,323 homeless students were enrolled during the 2014-2015 school year. My goodness, that sounds like quite a bit, doesn't it? Nighttime residents of homeless students for 2014 to 15, 181,386 were in shelters or transitional housing awaiting foster care. 958,495 were doubling up, so living with another family, friends, whatever. 39,421 were unsheltered. 82,159 were in hotels or motels. Wow, I just think that's staggering, absolutely staggering that homelessness is affecting school children to that extent. So the prevalence of homelessness. So the HUD, or Health and I think whenever something starts in an H, I think it should be Health and Human Services. But anyways, so Housing and Urban Development efforts to count the homeless. So there is this thing called a point-in-time count of sheltered homeless people, and actually it is also people that are not in shelters. So the reason I know this is because exactly 2 days ago there was a point-in-time count in Sheboygan. Actually, it was in Sheboygan, Manitowoc, and some other surrounding counties. I received an email about information about it, and actually they were looking for volunteers. They actually do it twice a year. They do it in January and they also do it in July. And basically they send teams of people, volunteers, out into the communities from 11 p.m. to 6 a.m. So we're talking about late night into the wee hours of the morning, and they are looking for homeless people. They're looking under bridges, they're looking into cars to see if people are living out of their cars, and the point is that they are trying to get as accurate a count as possible, because then they can deliver those statistics to government agencies and to get some help for homeless people. Apparently, the other part of what they do is they actually encourage the volunteers to approach homeless people, give them a questionnaire if they're willing to take it, and also try to help them, give them information on some resources for them. So that point in time count really is very, very valuable. So maybe that is something that some of you might be interested in volunteering for in the future. And actually, I would have really liked to have done it myself just to get that experience so I could tell you all about it, but I just had way too many other things to do this week with LTC, so just not able to fit that in. But anyways, so there is a homeless information management system. You don't need to have to worry about that. It's really just a database, and that data is used to compile an annual homeless assessment report. And again, different communities are eligible for funding based on that point in time count. So the caveat, though, we're going around trying to figure out how many homeless people we have in our communities. I really like this quote: "We would be wise to avoid the numbers game. Any search for the right number carries the assumption that we may at last arrive at an acceptable number. There is no acceptable number, whether the number is 1 million or 4 million. There are too many homeless people in America." So even though the quote at the top talks about that homelessness has been declining across the nation for a couple of years now, but still it is an ongoing issue. Factors that contribute to homelessness, so 3 kind of broad factors: a shortage of affordable housing, income insufficient to meet their basic needs, and inadequate and scarce support services. So those 3 really are factors that can contribute. Health status of the homeless population. Adults have higher morbidity rates, so they're sick more often. They have higher rates of pregnancy and complications, substance use disorders, criminal activity, marital dissolution, escape from domestic violence, housing accidents, limited employment options, job loss, poor physical health that prevented gainful employment. So lots of health issues for us to think about. Families can have compromised caregiver-child relations. Think about a family that is in a shelter, how difficult that would be to try to maintain any type of family life and child rearing practices when you're living in a shelter. For youth, certainly we have to think about unintended pregnancies, STDs, physical sexual abuse, skin disorders, anemia, drugs and alcohol, unintentional injuries, so accidents, depression, suicidal ideation, behavior disorders, family disruption, and social health is very severely compromised. The health status of people that are chronically homeless have a very high risk of death if they're homeless for 6 or more months, or within one or more than 3 hospitalizations or ED visits in a year, more than 3 ED visits in the previous 3 months, 60 years of age or older, cirrhosis of the liver, end-stage renal disease, history of frostbite, immersion foot or hypothermia, HIV/AIDS, co-occurring psychiatric. So I seriously had to stop and look up immersion foot because I was like, what in the world is that? I don't think I've ever heard that terminology before. So anyways, it relates to exposure, and it says immersion foot or syndromes are a class of foot injury caused by water absorption in the outer layer of skin. So another word for that is trench foot, which I think I've heard before, but again, it's not all that often. But just thinking about some of the problems that chronic homeless people have. They also may have co-occurring psychiatric, substance abuse disorders, and other chronic mental conditions or medical conditions. Excuse me. Oh, goodness. Homeless women have some particular health challenges. So higher rates of pregnancy, often unintended, higher preterm births, low birth weight infants, stressful life events. Maybe they were in foster care themselves as children. They had interpersonal violence as adults, hospitalized perhaps for psychiatric issues. And again, as I'm reading this, I'm just thinking about several different patients that we've seen on 1K that are, have been chronically homeless and also chronically admitted to the mental health unit. So history of violence, high risk for physical and sexual victimization, women veterans sometimes, being unemployed, disabled, or unmarried strongly predicts homelessness, and many report that history of having military sexual trauma. So Health and Human Services, homeless services, so frequent federally qualified health centers, and there are some federally health qualified lookalikes. Don't need to worry about the difference there, but just that there are services that are for those underserved populations, people that have low income or are homeless. So there are services available, and health care for the homeless. So Health and Human Services provides primary care and substance abuse services to those homeless populations. It's just a matter of trying to get people to those services and trying to engage them for help. So again, looking back at Healthy People 2020, 5 broad dimensions of those social determinants of health are defined within Healthy People 2020 as the things to really focus on: economic stability, education, social and community context, health and health care, and neighborhood and built environment. So now we're thinking about populations affected by mental illness. And I know we just had how many learning plans? 9 learning plans on mental illness. So we're really not going to be going into great depth at all because we've already done that in looking at different mental illnesses. But again, thinking about them in more of a public health context in terms of being a vulnerable population, and it may be difficult for some people to access care. So You know what mental health and mental illness is. So, mental health, the absence of mental disorders, emotional, psychological, social well being, and mental illness is that major disturbance in a person's thinking, feeling, behavior that reflects a problem in their mental function and causes distress or disability in their social, work, or family activities. So, from the American Psychiatric Association, we've got those two definitions. And so, mental health, a community's mental health, is a reflection of a community as a whole. So, I really do think that that puts mental health really at a very important place in our, in our healthcare system. So, it is a significant public health problem. It doesn't only affect the person with a mental illness, but also their family, friends, schoolmates, workmates, and other people. So some challenges in the community mental health nurse and the interdisciplinary team face multiple challenges, complex patient comorbidities. So when you're in clinical, we are going to be looking at comorbidities that people have. So it really will be interesting for you, I think, after having this information and assessing your patients and kind of trying to look at the whole picture, not just the person, the individual in the hospital, but what is their experience like when they're out there in the community? What are their challenges? How difficult it is for them to manage all of the various comorbidities that they have with a lack of resources. So again, lack of resources is the next thing. We need a competent mental health professional workforce and law enforcement. It sometimes is very difficult for law enforcement because they don't have the training that a mental health professional does to really interact with somebody in a way that's helpful to them. So sometimes different departments, law enforcement departments, might actually have special training that's offered as far as empathy or just learning how to communicate with people with mental illnesses. So if a community does that, it really is a very, very helpful intervention. So sometimes other problems, physical facility inadequacy. So think about Manitowoc doesn't have any inpatient care. So if somebody is mentally ill in Manitowoc, they need to come to Sheboygan. And Sheboygan actually has the only mental health inpatient unit for miles around. So many of the communities around us send their patients to Sheboygan Memorial. So, and just again, that stigma, that is always going to be a problem for people seeking help. And we'd like to get rid of that stigma. So, mental disorders encountered in community settings. So again, we have to think about that we're not just encountering people with mental illnesses in a mental hospital or in a psychiatric unit as part of a mental hospital, but in every different type of healthcare setting. So again, the scope is 43.6 million Americans have some form of mental illness, 20.2 adults have substance abuse disorders, and 7.9 million people had both mental disorder and substance abuse disorder. So we will be seeing people in every different type of setting. And of course, we're going to be seeing in community settings people with schizophrenia, depression, bipolar, anxiety, eating disorders, ADHD, suicide. So, and then now just a word about suicide, because I know we've already talked about that and we'll talk about that again in clinical too, but we have to always be thinking about when we're in any different type of community setting to be always looking for what are the risk factors. So what is that? What are the events in that person's life, their thoughts, their feelings, their support systems, or lack of, that are risk factors? So again, you'll be looking at that more closely also when you're in clinical. Think about their protective factors. Do they have mental health care? Do they have easy access to treatment? Do they have support from friends and family, and also from mental health providers? So we always need to be thinking about the warning signs of suicide and question those at risk in terms of thoughts, plan, lethality, means, and intent. So evidence-based practice management of mental disorders. So there is a national registry of evidence-based programs and practices. And so the goals of treatment for mental illness relate to reducing symptoms, strengthening coping, and promoting behaviors that are going to improve life. So, present day community mental health reform. So, mental health reform works toward monitoring federal legislation, administration activity, and public education initiatives. So, that makes community mental health a national priority by establishing early access, recovery, high quality in mental health services and standards. I do think that it seems to be taking a lot more, people are taking mental health more seriously. It is definitely out there in the community a lot more than it used to be. People seem to be overall taking these issues more seriously. But I do think that a lot depends on the political environment at the time too. So it's always a good idea for us as nurses just to keep an eye on where things are going in that direction and to really, again, advocate for patients as much as we can. So the medicalization of mental illness actually has been helpful because it has put mental disorders in parity with other diseases. So even insurance-wise, if a insurance company is willing to pay for heart disease and a heart attack, why wouldn't they be willing to pay similar amounts of money for somebody that has bipolar disorder and they have an exacerbation of the manic phase? So just some things that we should be thinking about. Community-based mental health care. So we really need to think about that the Affordable Care Act basically spoke to this and requires most individual and small employer health insurance plans to cover mental health and substance abuse, and that mental and behavioral health services were recognized as essential health benefits. So it's not just fluff to go see a counselor or to be on medication. It is something that is absolutely essential to somebody living, a life that is full and without that disability. So all plans must cover behavioral and health treatment. But again, I'm not sure where things are at as far as the Affordable Care Act at this point in time. So again, something we all kind of need to keep our eyes out for. So there is a multidimensional role of the community mental health nurse. So court representative, educator, researcher, collaborator, I won't read them all, but basically lots of different ways that a mental health nurse can be an advocate for people in the community. The next chapter is cultural diversity and community health nursing. I think this is about an hour, so I think I'm going to stop this recording and start again in a few minutes.